So, welcome to Aging, Healthcare, and Everything in Between. I'm Stephanie, and today we are talking to Tanya Farber from Senior Helpers. And we're talking about one of, I think, the most important topics for our aging family members. And it's really how we can get our loved ones to be able to stay at home, stay independent, but also stay safe. And I really appreciate you having this conversation with me today because I have so much respect and appreciation for what you do. I don't think there's enough home health care people and agencies out there. But, it's important. You're not only taking care of our loved ones, emotionally and mentally and physically, you're also giving us as the adult children sort of the peace of mind that our parents are being cared for and we don't have to worry about not being able to be there every day. So I appreciate what you do and thank you for being here.
Absolutely. Thanks for having me.
So let me start kind of a little bit more basic. Tell me what Senior Helpers does and how did this become your mission?
You kind of introed and segued to that just perfectly. So Senior Helpers, we do provide in-home care. We are called Senior Helpers, but we can service anyone that's 18 years of age and older. And so we service the elderly population. We also service those that are living with disabilities. And as I mentioned, you segued to that just perfectly because I am kind of that generation or that key target market for our home care services because I'm that daughter that is kind of in that sandwich where I have my own family, I have my own career, and I have aging parents. I unfortunately lost my father to cancer, and I have a mom who has significant health issues. Most recently, we just went through a battle with non-Hodgkin's lymphoma, which she's currently in remission, so that is good. But I was living actually in Montana. I live in Fargo, North Dakota, and that's where my agency is. But I was living about 9 hours from my parents when my father passed and when my mom needed me most. And so living at a distance, that's kind of a population of my clients and their families that just really grabs at my heart because I know how difficult that is when you are not there to have the eyes and ears on your loved one all the time. And I love to stay in touch with those families and keep them posted on how their loved one is doing if they're under our care so that they feel like they're not so far away from them. But that was largely, I saw the need. I learned about home care. It's not widely known. And I learned about it and then I saw the need and my family and I made the decision to move back to Fargo in 2019, right before COVID. And with that move, I just decided this is exactly what I wanted to do. I have a background in nursing. I have a master's in business, but this was truly my heart's calling to provide that service and be that trusted advisor to the clients and families in my hometown and surrounding communities.
Yeah, I think that's amazing. And even if, sometimes we're really far from our loved ones, but sometimes, like my mom, she's only an hour away, but you can't go and see her every single day when something comes up. So even, in the same town, I think it's important. What kind of, everybody always wants to stay at home. They want to age in place. They want to stay at home. Nobody, of course, wants to go into a nursing home, but it's not always easy to stay in your own home. What kind of barriers or what do you see that causes that to be a problem for people?
Sure. So a few things come to mind. One, I do think there can be a financial barrier, whether you're going to choose to live at home or in a nursing home or living facility at this phase of life. I know I meet, unfortunately, a lot of prospective clients that just really haven't financially planned for their care needs. And again, whether that's perceived because sometimes they do have the funds, but unfortunately, providing or paying for additional care services is not really maybe where they thought they would be in retirement. They're thinking they're traveling the world or, they're doing all these other things and allocating money to home care is not really what they want. They're trying to save to be able to pass that on to their loved ones as well after they're gone. So I think there are some financial barriers, but there are a lot of options. Our veterans have veteran programs that they can receive services paid for if you have a long-term care insurance policy, particularly with a home care benefit that can pay for services. There's reverse mortgage options. So if finance is a barrier to care, each state also has like an aging resources hotline. So anybody can call that number at their local state level and find out if they qualify for any support to stay in their home. There's plenty of grants out there. North Dakota has a wonderful one right now where they really are trying to incentivize people to stay at home, and that's wonderful. I do think a lot of people do. The trend is people want to stay home. I do actually have clients, however, that when I meet with them, I actually refer them to a facility because it just really depends on what I think they're looking for. And I think if you're younger and you still have that ability to be highly active in a facility and engage, it can be a really wonderful place for them to be too. So it's important to just figure out what your family member, where they're at, what they're looking for, what their desires are, and start early kind of exploring what those options are.
Yes, I agree. One of the biggest things is the financial side of it. Everybody thinks that their Medicare plan will cover home care, and it just doesn't. That's not Medicare is designed to get you better and get you out. When you're aging, that's not something that's covered. And I also think that that's why talking about this and having this conversation with your loved ones long before it's needed is necessary, because you can put a plan in place. Also, people always think that, I'm saving money for retirement. Well, that's great. This is part of retirement. This is part of what you need. You need to allocate a portion of your funds toward care. And if you're doing it early enough, you can set it up so that you can be in the independent, community that you want to be in, or be at home if you want to be. But you have to plan early, I think.
100% you do. And to your point too, it's easier to start those conversations earlier, maybe before the actual need is there, so that they start to open up their minds to the idea of having additional care, whether it's in the home or going to a community living space. When it becomes a little bit more adversarial, when the need is there and it's time for the care, and the loved one, the child, like myself, is kind of more forcing the issue because they need to do something in order to stay safe in their home. If they can be part of the plan and part of the conversation, it tends to go a lot better.
Okay, so how do we have that conversation? Do you have any tips? How do we approach them? How do we talk about it without it being, we're putting you, somewhere, so that you're safe?
Yeah. So again, it's inviting them into the conversation. I think making them a part. The most successful conversations I've ever had in the home are where we're talking together. And it's not me and the daughter or son or loved one coming at them and saying, this is what's going to be happening to you. It's really getting started and involving them. And it can start as simple as inviting someone in, even just a couple times a week. I think the biggest thing, and what we tend to do at Senior Helpers, and I'm sure other home care agencies are similar, is we are really where I get resistance is they don't feel like they need help, or they don't want people doing things for them. We're talking about a generation that has a lot of pride in being able to take care of themselves, and maybe if they still have a spouse that's living, they're the primary caregiver, and they take a lot of pride in having that role. And so we don't want to take that away from them. Our goal is to continue to promote their independence. We're not there to do things for them unless they absolutely need. Of course, we have that client population that they physically are not able to do things anymore, but we're there to support and promote their safety. I always like to share, we had a client, and one of her biggest needs was she loved to cook and bake, and they had a garden and they had fresh vegetables, but she lost fine motor skills to be able to chop. She could no longer reach to get things up in a cupboard. So she had us in for a variety of things like laundry, but cooking and baking was a big thing in her why, and what mattered most to her. And she was able to do it with us or with her caregiver. We just had to support for those little areas that she just needed help. She couldn't do it independently anymore, but it became a fun activity, and the caregiver became, something that she looked forward to inviting into her home and kind of developing a trusted relationship with. So the other thing I always stress is, ideally, when you're starting out with care, there's 168 hours in a week. Now, we do care for people 24 hours a day, 7 days a week in their home if they need that. That is not the norm. And so I like to remind people, depending on, what we decide and prescribe for the recommended level of care, if it's 8 hours a week, 20 hours a week, you have 160 or 148 other hours to yourself. We're not in here on top of you all the time, but think about those things too. I always think about making beds, like when you have to change your linens. I would gladly have a caregiver come in my home and do that task. I hate lifting up that mattress and getting that fitted sheet on. So just think about those care tasks too that are unpleasant for you and have someone do it. There's nothing wrong with that. So again, I think it's really all in the presentation. It's all in inviting them into the conversation, making them a key player in the decision, not making the decision for them, and doing it early enough that they can be an active participant, and starting bringing someone in kind of slowly so they get used to the idea of having someone around.
Yeah, and I understanding too that home health care is not just medical, it's all those other things that you just described and probably more.
Mm-hmm.
So there's a range of services. It's just helping someone stay safe in their home and stay in their home, right? Right.
And I think too, as family members, as the daughter of, my mother is a key example. It gets to be challenging when you're trying to balance that career and that family life and do all of the care needs. And also, I think it's important just to remind your loved ones that you're there for them, but it's also nice if you can just be the daughter and not be the care provider. You don't want to necessarily be the one that has to get all the groceries, do the laundry, do the house cleaning, maybe help them shower. You can do those things, but I'd rather spend my time with my mom doing something more fun than having to do the care tasks. Bring in home care, bring in us to do those care tasks, and just be the child, be the loved one, to enjoy the time that you have together.
Yes, the home health care person is not replacing the son or daughter. They're adding to our time, adding to our everybody's quality of life.
Exactly.
So then, how do we know when home care may be appropriate? Like, are there, we all, of course, everything slows down, right? You think a little slower, maybe it takes longer to go to the grocery store, all those things that we see happening with our parents. But how do you really know when care is appropriate?
Yeah, there's a lot of clues. And in your example, your mom's an hour, was it your mom, I believe, an hour away. And in some cases, families further. We're in this key time of year right now with the holidays that maybe someone hasn't seen their loved one for a couple of months, part of a year. But if you're starting to notice, so those changes might become more like abrupt if you're coming into their home after not seeing them for a while. But if you're starting to notice that their appearance is becoming more unkept, their hygiene is declining, they're wearing the same clothes, their shirt's dirty, maybe you're finding wet, soiled underwear, pants laying around in the shower. You're finding old, spoiled food in the refrigerator. You're noticing they're losing weight. They're just not eating. Maybe their medication planner has days and times of day that they've missed their medications. They're becoming more confused. The house just is not being kept up. Maybe they're sleeping in a recliner because they're having a hard time getting to their bed, or laying flat in their bed because of some issues that they're having. Maybe they've had falls. Maybe you're noticing some bruises on them. There's all kinds of signs that can indicate it's time for a higher level of care for that individual.
So then if it is time, how do you find someone? What kind of questions do we need to be asking? How, that kind of thing.
Yeah, so it's good to look at options. So again, communities, a lot of communities will have like a resource guide. Here locally, we have a senior resource guide that's going to highlight all kinds of different things, whether it's just getting some assistance with home delivered meals. Maybe it's assistance with home care. Maybe it's PT. Maybe you are deciding to move your loved one into a facility and you need help going through their belongings and getting things packed and donated and finding out what's of value and what's not. There's services for that. So looking for those guides, again, you can call. Each state will have a senior resource linkage or line. Going online, doing your research, you type in home care around us if you're looking for home care, and it'll give you a whole list. And then I just recommend going through, contacting each, asking, a series of questions. Common questions, of course, are, what are your rates? Do you have a minimum number of hours required, a minimum number of days? Things I would look for I would maybe ask how long they've been in business. I tend to, I was new at one point, but you learn a lot, and after time, and you've built a more stable client base, you tend to have more reliable caregivers. I definitely would ask about caregiver reliability, depending on the care needs of your loved one. If you absolutely need to make sure that that shift happens, then what is the agency's backup plan should the caregiver call out, or if there's inclement weather? How reliable are they, and what is their backup plan in place? So those are some really good questions to ask. And then, you might ask if they have anybody, a current client that they'd be willing to have you talk to. So to find out what it is like to have services, and always know there's options. Most agencies are going to have an agreement that you sign. You're not committed long-term. If it's not working out with that particular agency, definitely work with them to see, let them know what the issues are, let them work to fix it. But if it's just not working, there's becoming more and more home care agencies, just because this is the direction that our population is moving, is wanting to stay at home.
Yes. And I do see a lot of home care agencies out there, but it always seems like there's a lot of turnover. So I would think that's something that they should look into too, right? Like you said,
Yeah.
making sure that person's going to be there for their shift, and if they're not, what's the backup plan, right?
Right. Yeah. And unfortunately, going back to one of your earlier questions, barriers to staying home. Barrier in our industry, whether it's a living facility or a home care, is just the barrier to having caregivers. The caregiver supply does not meet necessarily the demand of patients, and that's not going to change anytime soon. So the really good agencies are looking for ways to make sure that they are taking good care of those caregivers. They're giving them proper training and education. They're retaining them. They're checking in on them. They're doing quality checks, all of those things to try to retain the limited supply of caregivers that we do have. But it is an important question, and it's a problem we all face. But again, some agencies, and that's where I tend to say, like a more established agency, one of the challenges was when you're new, you don't have a strong client base, so you don't have hours necessarily to give to a caregiver. So you run into a lot of turnover in those early days until you can establish a pretty consistent client base that gives them the hours that they're needing to feed their family.
So now, if we are able to have this conversation with our family and they agree, yeah, let's put some kind of plan in place. What are we looking for? But they don't need anything now. What are we looking at in the next 10 years or so? Should we focus on home care? What do you see happening in the industry in the next few years?
Yeah. Again, so there is definitely a push for home care. I would say too, if you're looking at facility, and there's no reason you can't explore both. If you're looking for a facility, oftentimes there's waiting lists. And so kind of really projecting that need as close as you can to get on that waiting list so that you have a room when the time comes. Now, even in that scenario, home care can be a bridge. So if you're waiting for placement, for your room to become available in the living facility you've chosen and you feel comfortable with, home care can serve as a bridge while you're still in the home to make sure that you're safe and that you're free from falls and all of those things. And even talking about, going back to your first question about the barriers and finances being one, there's also there's a lot of agencies that we can provide some in-home monitoring systems that are very kind of passive monitoring, but they give a lot of insight when we're not in the home into patterns of and behaviors of the client. Like, how many times are they getting up at night? Are they wandering? What is their nutrition hydration status like? How many times are they going to the bathroom? Are we getting maybe an insight into the fact that they have a UTI? Is there a fall that's occurring when we're not there? So if someone can't afford necessarily to have someone physically present, or they don't want someone physically present all of the time, there's a lot of us that can offer some in-home monitoring services that are very discreet. The loved one doesn't necessarily even know they're being monitored. And then there's alerts that can be given to the family member or the agency if something is starting to cause alarm.
So we first have to determine what kind of care that they want, and as they age long term, do they want to be in a community, in an independent community where they can move to assisted living or memory care if necessary, or do they really want to age in place? And if they do want to age in place, what do we need to do to the house, and what kind of home care services might we be looking at, all those kind of things, right?
Right.
And
So one of the things that is near and dear to my heart is the home safety assessment. So in our agency, we do an in-home safety assessment. We look at 144 safety risks that can be present in the home that can cause potential for them to fall or just be unsafe in that environment, depending on the condition that they have. So I love to do those home safety assessments and make the recommendations for things that they need to do to modify the home to be safe, or things that some durable medical equipment that they need to purchase to help them live in the home longer. So very important home safety assessments are very, very, very important.
It's something I've never heard of. So I think a lot of people don't even know that that's something that a home care agency can do. There's so many different services that you offer to help us plan.
Yep. That was the first thing I did when I moved back here to Fargo, is I got my mom into a different, she still wanted to live at home, but the home that I grew up in was no longer safe for her. She had her laundry on the lower level. There were stairs. Her shower wasn't, like handicap accessible, safe. So I moved her out of her house. And that was one of the best decisions we could have made for her.
Yeah. Sometimes just a smaller apartment or a villa, where you don't have to worry about the house is enough.
Yeah.
Well, thank you so much. I think what you've given us is a lot of great tips, a lot of great insight, and I really appreciate what you do. Thanks for listening to another edition of the Aging, Healthcare, and Everything in Between podcast. Please share this podcast so that others can benefit from the content. Please also leave reviews, as feedback is important to me. And if you have any suggestions for a future episode, email them to s.pogue@stlouisinsurancegroup.com. Thanks again for listening, and I look forward to bringing you more valuable content soon.